Hello, everyone. I think we can start. All energy in the house, please. Can I see everyone's hand? Yay! Okay, so without any further ado, I would like to call upon on the podium Dr. Tansri Jamila Mahmood.
Friends, ladies and gentlemen, it's such a pleasure to be here. Let me tell you a little bit about the background, how all this happened. So Kent and I met in a cafe in a little hotel when you were here last year. And we were lamenting how, I think the work of Global Health 50/50 is so important, really spotlighting on the gender, dimensions of not just planetary health, but health writ large. As a health professional myself, we know that, women are sometimes the backbone and workforce of the health system, but often unseen and, and sometimes underrepresented as well at leadership levels. So when I was talking to Kent about, the summit and the annual meeting, I think he stepped forward and said, we should try and bring this to the summit. And of course, I warmly welcomed it. And what is stunning is the results from the work as well. I was shocked that it was like 2.2% of board seats in organizations that work on planetary health are held by women from low-income countries when they are actually the ones impacted by the climate crisis. And I think that figure, puts us all to shame. I think that, leadership and policymakers, organizations have not seen the importance of the gender dimensions of planetary health. So really, Kent, huge thanks to you for agreeing to work on this with us and use this platform at the Planetary Health Summit to launch this very, very important piece of work. Now, I've talked about Kent without telling you who he is, but he's the co-founder and co-CEO of Global Health 50/50. He's an intersectional feminist, political economist. He has expertise in health policy analysis. And those of us who have worked in this space, whether it's through the UN or other NGOs and so forth, know of his very important work. He's published widely on gender rights, equity, inclusion, and accountability in global health, and applies these lenses to current global health concerns. And I think that in his role now, with the Healthier Societies Research Program at the George Institute, which is a really progressive and an institute I really like, and his appointment at the Faculty of Medicine at the University of New South Wales. We're really looking forward, Kent. You're part of the region here. One of the, my big push was, these discussions need to happen in the Global South. So I'm really delighted that, all of you made time and traveled to be here. And, I'm just so excited and so grateful that this report is launched at this very historic meeting. So over to you, Ken, to introduce the wonderful speakers that you have.
Terima kasih, Ibu Jamila, and terima kasih, Nazia. Thank you, and good afternoon. I want to thank our hosts. I want to thank the Sunway Center for Planetary Health for convening us, but I also want to thank you for your partnership over the past year. Right, I had the same. Okay, I thought I had a loud voice, but here we are. So good afternoon, and it's good to have you here after lunch. And I just want to start by commending all of you for your work. You do vital work. It's important work, and it was neglected for far too long, and we have a lot of catching up to do now. I'm delighted to be here in Kuala Lumpur to launch our report this year on gender justice and planetary health. But before my colleague Manasi outlines what we did, and the constraints and the limitations to our methodology in terms of what we could do and also what we found, I'd like to say a few words about GH5050. Next slide, please. The clicker doesn't work, sorry. So GH5050, Global Health 5050, was set up about 8 years ago with my partner, Professor Sarah Hawkes and I. We were concerned that the issue of gender and health wasn't getting the attention it deserves. And I think there are some parallels with the issue of planetary health, and perhaps there can be some learnings from what we've discovered over the past 7-8 years with this initiative. But before I do that, I just want to make sure that we're all on the same page in relation to sex and gender. So sex is really about biology, and gender is a social construct. Gender is really about the power relations between sexes and how those power relations or those relations play themselves out in terms of roles and expectations and behaviors. And so I just wanted to make that clear because there is quite a bit of confusion about that. So back in 2013, we had been working on gender and health for 10 years, including things like setting up sexual health clinics and so on. And we saw that there was a strong relationship between gender and health outcomes. There are very gendered determinants of health. There are very gendered health-seeking behaviors. There are very gendered healthcare systems. And so it's not surprising that we see differences between men and women in terms of the prevalence of disease, the risk exposures, and the health outcomes, and who's dying of what and who gets sick of what. So we pulled together all the available evidence around the gendered nature of health, and then we looked at the top 10 global health organizations, and we found that they were largely gender blind. And so they were missing a huge opportunity. Had they been tailoring their interventions to the gendered nature of the determinants and the seeking behavior, they could have had a lot greater bang for their buck. And that simply wasn't being done. And we published it in The Lancet, which is a reasonably impactful medical journal. And it fell on deaf ears. There was just no interest in this. And so we thought, well, let's do something differently as academics. And we set up GH5050. I'm happy to talk a little bit about our theory of change if anybody's interested in that. But essentially, we're an accountability mechanism for gender in global health. And I think that it's fairly self-evident that if you want to hold an entity accountable for something, you need to know what its objectives are, what it's trying to achieve, and you need to have some sense of who's meant to be doing what. But if you then add a human rights component to that sort of thinking around accountability, there are 3 additional dimensions. One is around independent monitoring. So the entity or the person being held to account shouldn't report on how well they're doing. There should be an independent entity that takes an objective measure of how they're doing. And that's what we at GH5050 do. We also push for transparency, and we put the data that we have in the public domain so that other people can attempt to hold these entities accountable for what they're meant to be doing. In our instance, in our case, we're interested in gender justice in global health. So what we do is we assess 200 global health organizations every year for their practices and their policies around gender equality and health. And we produce reports with very simple infographics and quite captivating imagery, I hope, that we then put that information in the public domain, and that will enable donors to organizations to attempt to use those data to hold those organizations to account. It will hopefully get the boards to act on that information. But importantly, we put that information in the hands of often young women who use that information to say our organization could actually be doing a lot better. So every year we look at 10 variables across the 200 organizations. And they cover things around what the organization's doing internally and what they're doing externally in terms of who benefits from their activities. And you can see that we look at, I hope you can hear me, we look at their commitments to redistribute power, so their commitment to gender equality, how they define gender, and then their policies that they have in place or not to tackle power and privilege and overcome those inequalities. And so their workplace gender equality policies, their workplace diversity and inclusion policies, and their board diversity and inclusion policies. And then we look at who has power. So we look at the parity of their boards. We look at the gender parity of their senior management teams. And then we look at whether or not they make a commitment to and actually sex segregate their data. If they don't sex segregate their data, we don't know who's being impacted and who's benefiting. If they don't do that, we're all flying gender blind. So next, oh, I've got the power. And then what we do every year as well, in addition to those 10 variables, is we do a special themed report. And this year we're doing a special themed report on planetary health. And we're doing it in part because of the coffee that I had with Jamila, but we're also doing it in part because, like health, planetary health is obviously gendered. Men and women face different risk exposures, depending on the occupations that they have, which are often determined by gender norms. And well, I don't think I'm going to say anything more than that, than say that we've done this report and we're going to present, Manasi is going to present some of the findings now. And Manasi's my colleague. And Manasi, if you want to come up here, please do so. Manasi is one of the researchers at GH 5050. She's part-time. She also works for local government in the UK. And she completed an MSc recently, and she's trying to write that up, I understand, into a publication. And but I also just want to say that this is her first international speaking engagement. So I'm hoping that you can lend her all the encouragement and support that she needs. Manasi, over to you.
Hey, hello. Wait, higher. Hey, everyone can hear me? Amazing. Thank you so much. Thanks, Kent, for introducing. Yeah. Our work. And yeah, like you said, this is my first time speaking at an international conference or at all publicly. So yeah, very excited to be here and share our report's findings with you. So let's dive into that. So that's our report this year is examining whether many of the world's most influential actors in global health are integrating a gender lens into their planetary work. And we think this is really important given the growing political interest in planetary health, and that there's also so much more action being taken in addressing the environmental and climate threats that are affecting human health. So let's dive into the methodology a little bit. So I'm going to walk us through our sampling frame. Kent mentioned that we have a total sample of 200 organizations. And of those, well, 197. And of those, sorry, and they come from the sectors that you can see highlighted at the bottom here. Of the 197, we excluded 18 organizations for this report because they did not have a health improvement mandate. And then further 65 were excluded for not having any external planetary health work. So our final sample consists of 114 organizations, of which 99 are nonprofit and 15 are for-profit. Okay. So our report asks these main questions. Having identified whether they do planetary health work or not, we wanted to understand whether they consider gender equality in their planetary health work, firstly. Secondly, do they report sex disaggregated data from their planetary health work? And lastly, what the diversity of the board membership looks like, both in terms of gender, but also nationality. And we're presenting these findings differently for the for-profit and non-profit sectors, simply given their inherent differences in their roles between profit-generating companies who have more of an interest in health and organizations with core mandates to advance global health and social justice. Okay, so let's dive into the findings for the nonprofit sector. Having identified the 99 organizations that are active in planetary health, we looked at their gender considerations, or the extent to which they integrate gender in any, even if not all, of their planetary health activities. So within the sample of 99 organizations, we categorized 24% of them as having planetary health activities that also recognize the structural causes of gender inequalities. And this was what we comprised as, this was what comprised the gender transformative category. Over 1/3, so 37% of the sample did not mention gender in any of their planetary health work, and the remaining 38%, their planetary health activities responded to specific needs of women and girls alone. I should mention here that none of the gender-specific activities we found had anything to do with men and boys or any other genders. And here are a couple of quotes to show you how we categorized these organizations as gender transformative or specific. And you can see here that in the gender transformative one, they're referring to gender dynamics and how that's influencing people's vulnerability to climate change and what can be done about that. Whereas the gender specific one is looking at something that's more targeted to gender roles of women being caregivers and nurturers. So for example, here we're talking about clean cooking technologies and how a woman should reduce her exposure to air pollution that may arise from this. So our next variable was whether the organizations report sex disaggregated data. That is, do they collect, tabulate, analyze, and report data separately for men and women? Why is this important? Well, because analyzing this shows us whether there's any differences in the situation between men and women as a result of gendered roles and expectations. And so we strongly advocate for organizations to report this kind of data. But as you can see, there's only 18% of the sample who actually reported that sex disaggregated data. And we also, and you can see a couple of quotes here for how we categorize that. Next, we looked at the diversity and who is leading these organizations that are active in planetary health. So we looked at gender and nationality of CEOs, board members, and board chairs of these organizations. We found that 38% of the CEOs are women, and that there is gender parity in the board membership of the nonprofit organization. Yay. But it is big, it's good. But then when we look at the nationality breakdown, it's not such a pretty picture. To look at who, given that board members have such a sizable say in the organization's decision-making, and given, so our sample was 921 board members. But yeah, this is not such a pretty picture because we found that 68% of these board members hailed from high-income countries, and 38% of the sample was the US alone. The most shocking stat here is that 2% of the board members were women from low-income countries. And we've just heard that that's the community, that's one of the communities that are most vulnerable to climate change. So yeah, it's some food for thought about who has a voice in making decisions about planetary health crisis. Yeah, and that's just a map, which is probably not terribly clear to everyone at the back, but it's the really large circle on the left is showing us the United States board membership representation compared to some of the other countries. This image is there in our report, if you would like to look at that later. So the Global Climate Risk Index are an organization which identified the 10 countries with the highest loss of life due to climate breakdown per 100,000 of the population during the years 2000 to 2019. And yeah, these are the countries, and this is the board representation by these countries. Again, not a lot. Okay, so let's now move on to the for-profit sector. Our sample here was 15 organizations. And of these, we only found one organization to have gender transformative, a gender transformative commitment to in their planetary health work. And there were two that were gender specific. And there was not a single organization that reported any sex disaggregated data. In terms of board membership, again, the majority of board members were nationals of high income countries, with just one woman and no men from any low income countries. And there was no representation at all from those 10 countries that have been hit most severely by extreme weather events. So this absence of gender inclusive and geographically representative planetary health leadership in the influential and resource-rich for-profit sector represents a significant underutilization of the power and strength of the sector. And it really is just a missed opportunity in addressing the pressing challenge that is planetary health. So that's it from me. Thank you for listening. I now pass on to my colleague, Professor Jasmine Gideon.
Great, thank you very much. And thank you, Manasi, for presenting that. That was all very clear. So yeah, I'm Jasmine Gideon. I'm also a researcher at GH 5050, and I'm also Professor of Global Health and Development at Birkbeck, London University. And most of my work is on different aspects of gender and health in different contexts. Sorry, just confirming. So yeah, what we're going to do now is we've got two speakers, Nicole Redvers, who's here with us in the room, so I'll introduce her subsequently. But first of all, our online speaker, who unfortunately couldn't be here, is getting set up. And sadly, we did have a Malaysian speaker as well, but again, she had a conflict of timetable, so she wasn't able to join us in the end. So we're conscious we don't have any kind of national representation here from Malaysia. But Valko Celestino is Senior Social Development Specialist in Gender and Development at the Asian Development Bank, where she works on climate change and sustainable development. And she's responsible for integrating gender analysis and measures into investment projects and for strategic and operational initiatives to promote gender inclusive solutions in private sector financing. She's an experienced professional on social development in investment finance and private sector development, and has experience across sectorial operations as well as stakeholder and strategy engagement. She's also qualified in project management and notably managed several institutional initiatives, including a major multi-partner flagship program promoting women in business, access to finance, and gender equality in economic development. So once she's set up, Anne is going to speak, give some responses to the report. And oh, I'm sorry, we also had some questions that speakers were asked. I think maybe they're on the next slide. No. No, we had panel questions. I don't know if there was another slide. Maybe it's not there anymore. Is there a slide after that? Okay, yeah. So yeah, we Anne and also Nicole subsequently were asked to address these general questions. So I'll hand over to Anne and then I'll come back up and introduce Nicole. So let me hand over to Anne, who is there now, but she's got.
Thank you very much, Jasmine. I hope you can hear and see me well. I do apologize for the light. I'm in another event workshop, so that explains the yellow quality. And let me just take 1 second to share my screen.
You should be able to do so.
Yeah. So I'm taking over exactly. And so again, let me start without further ado. Good afternoon to Jasmine, Nicole, all speakers, participants. Thank you for having me online. It would have been a pleasure to be. I'm next door, I'm in Manila. And so as Jasmine was saying, I work for the Asian Development Bank, where Manila is our headquarters in the Philippines. And today I'm also representing the Chroma Collective, on which I will speak in a bit more details in the slides, and also makes the link with the report and the information and findings that were shared in that report by the Global Health colleagues. I have brief remarks. I'll go through them with a series of slides to really talk about the work at the intersection between the two axes that have been presented, so gender, equality, and planetary health. And we refer to them as the green agenda. So I'll just change a bit of the lingo here. And I hope that with the remarks, it will provide a worthy addition to the dual agenda that we're discussing and the interlinked impact. I think one of the questions we'll look later. And we'll also be empowered and enabled to make that more inclusive and sustainable world for wherever dimensions that our work takes us. So as I mentioned, in my capacity at the Asian Development Bank, I joined the Chroma Collective, and it's a dedicated group. We created a compelling, intuitive tool that advances on the gender and green agenda, and I'm going to present that today. It links well, if I just make a short linkage with the report and the concerns that were highlighted in the report on the collection and publication of the data, having women in leadership, and private sector lagging behind. I hope you will see also through the platforms how that resources and knowledge is shared to try and push on that agenda. And all the points I think noted in the report are common features that we see in the project, in the work that we do as that collective from our own institutions. So it actually leads really well of the findings and what we see on the ground in sort of projects. So here, let me just share a bit on what Chroma is to understand where we stand. So it's a growing network of gender practitioners. We all come from different institutions. I'm from a multilateral development bank. Some are more donors, some are more sector-oriented from the global, so World Health Organizations, or others from the Gates Foundation. So very diverse background in sectors and way of intervening in the countries and their projects. But we all have that in common, that we work on gender equality, mainstreaming, and systems. And under that, we use a more human-centered approach to help kind of design what common problems we have and come up with some innovative tools or products that anyone in the community and beyond could use. And the nexus of gender and green agenda or planetary health was one of the main and the core problem element that the group as a collective identified. And from that, we defined a working group to say, okay, so that's one of the main topics. All our institutions, or most of our institutions, are moving towards being a climate financing institutions, so how do we work and come up with something that have the gender and the green and the green together? And that's how the working group on that was defined. And under that, and that led to eventually the platform. I was mentioning the variety of institutions. So here it's just a visual to show you the spread and the range of geographic areas, of sectors, and of type of financiers, donors, investments, and so forth. So it's very rich to work and exchange and really build work with different representatives of such a diversity of institutions. So personally, I find it very enriching, and I really benefit from that setting. And so a bit about how, so with that working group of selects, and was mostly, if I may, from the Asian Development Bank, the Canadian also development agency, the Australian development agencies that have climate such as big money coming in, right? So we're establishing climate financing mechanisms, and we're raising our flags saying, well, I don't want to say let's not forget about gender, but how do we ensure gender is embedded, solutions is embedded into this climate financing mechanisms? So that's how we basically came with the idea of, all right, so let's get as a working group and think, and eventually led to the idea of creating a knowledge platform on this nexus. And we started by doing an analysis of the gender donor and funder ecosystem. We mapped the institution, who's working on what and how in terms of gender equality in the global development, so have that wide understanding. And then we took the part where there's heavy investment on the green agenda, and where does the gender fit in or not, or how it is not fitting, right? And then you bring them together, and we thought, so what can we as institutions, as gender practitioners in those big institutions, move the needle, and what would serve, what would be useful for most stakeholders? So we thought of kind of creating a tool to, if I may say, remind people of the integration of saying gender and green, they're not mutually exclusive. And how can we make it as easy and practical so that anyone, you don't have to be a gender practitioner, you don't have to be a climate expert, but it's really anyone getting on that agenda can actually use that and be aware or informed of this dual nexus. It's everybody's business, right? It's and I think that the findings you say, you have the whole institution, how do you gear that once? So we giving here a snapshot. It's a kind of, we like it because you'll see it's nothing like the usual institutional gender work. It's a very intuitive, I'll share the link after so you can have a look yourselves. It's a very intuitive, rolling, kind of engaging knowledge platform, if you want. It's not a website per se, but it's on the net and available to everyone. And then so we present first all these reflections in the case of, okay, how does the green impact gender on women differently and so forth. So you have those scroll downs. And what is very unique and actually a value add from this platform is that we took all the resources that we have from the institutions as a starter, right? Because the world is so vast. So as a starter, use what us as institutions have in terms of knowledge, and put that under here a big unified framework where we have on the horizontal the gender nexus, and then vertical the green agenda nexus. And we group that as projects or example projects, more case studies if you want, but really references of saying, you looking for what does it mean having a project that does both green and gender. So you look at that layer side of that framework, you click and you have the examples of the projects, the context, but also the actions, because most of the projects would have like an agenda action plan, the actions that each project does that shows you really the linkages between the green and the gender. And some sectors may be more intuitive, like if I take the far right about climate resilience, it's how you build the woman's capacity on how to do better practices in the field, right? The gender in the front seat, if I may, that's actually one of the Asian Development Bank private sector investments. How do you bring women into the e-transport sector, right? So it's all about the green jobs as well as addressing some barriers and biases and women being bus drivers and how do you ensure the safety and all that. So you have all the information on those projects, which we think are very helpful as practitioners, either as gender practitioner or climate or other practitioners. I have this project, how do I make it green and gender? And then we have a whole section on that platform that gathers tools and resources. And we thought there's so much out there. It's not about producing more, but it's about putting together like a catalog of what you can find and how you can, use that reference at best. So it's really about supporting the work that we all do and effectively engaging. That can be used as either a training tool or just for one's knowledge. You can just scroll and use it, and you can also see how you fit. Oh, I'm actually a gender practitioner. I don't know much about the green, so I need to boost also that in my, or the other way around. I'm climate, I have no idea how do you do gender in that. So we're really hoping that it helps bridge the kind of gaps or in between the two expert sectors. So here's the QR code. You can click and then see the platform for yourself. Take the time to scroll and share, and appreciate any of the feedback as well. It's a kind of moving because it's knowledge, right? So knowledge is always more coming up, but it's really kind of as a public good driven by a collective. So I think that's one of what I wanted to share today as a link towards also what the findings, both of the positive and the references from the reports we're showing as one practical way of contributing. So let me close here my remarks, and I'll probably see you back with the questions. Back to you, Jasmine. Thank you.
Thank you very much, Anne. That was great. And yes, we hope you're able to stay for the Q&A. So our second responder commentator is Nicole. So I imagine some of you heard her speak this morning. And Nicole, Dr. Nicole Redvers is a member of, sorry if I pronounce this incorrectly, Deninuku First Nation, and has worked with Indigenous patients, scholars and communities around the globe her entire career. She's an associate professor in the Department of Epidemiology and Biostatistics and is a Western Research Chair and Director of Indigenous Planetary Health at the, again, a word I can't pronounce, Schulich School of Medicine and Dentistry at Western University in Canada. She's been actively involved at regional, national and international levels, promoting the inclusion of Indigenous perspectives in both human and planetary health research and practice. So I'd like to invite Nicole up, and then, yeah, after Nicole has spoken, there'll be an opportunity for questions from the audience. So thank you, Nicole.
Yeah, I'm just going to grab it. Easier than fiddling. Thank you. Thank you for the remarks as well, and the warm introduction, and also the work on the report. I took quite a bit of time on the very long flight over here, really reflecting on the report and some of the findings. And as Jamila had noted before, some striking findings, but also some unsurprising findings. And part of my work is at the intersections of gender, of course, with groups like Indigenous peoples, because we often see even lower proportions, of course, of BIPOC communities, whether or not it's Indigenous peoples of color. And my assumption is that despite the high number of board parity, for example, noted on the nonprofit organizations, my assumption is that the majority of those folks are not from ethnic communities. But again, an assumption made. But I wanted to provide some reflections on a few different points that maybe others may not be reflecting on. And one of the things that I really had to think about was the finding, again, unsurprising to me, that none of the gender data that was reported from, again, the nonprofit side, because there was no data reported in the for-profit side, was that there was no data for men and boys. Now, from an Indigenous perspective, we see Mother Earth as the feminine. That's very common around the world. And one of the things that's been striking, particularly in many of our Indigenous communities that are inherently matriarchal. So we tend to have women as the heads of community and families within our nations, although there's exceptions to that in places around the world. is that the majority of the planetary health work that we've seen from within Indigenous communities has focused on the importance of having men and boys understand the importance of the feminine as a part of Mother Earth's health, or the planet's health in this respect. So because of that, we had a number of knowledge holders, elders, Indigenous land rights defenders, a number of years ago come together to define what we call the determinants of planetary health, bridging off the determinants of social determinants of health, of course, which everybody hopefully understands, the situations where we live, work, grow, the things that impact our health. But the determinants of planetary health were situated as what are the things that makes the planet well. And one of the key determinants of planetary health that came out through that work was respect of the feminine. And because Mother Earth is looked at as a feminine, any abuses on Earth, whether or not it's resource extraction or otherwise, is looked at as violence against women. And in fact, there's been global data demonstrating that in areas of high resource extraction in the world, there's higher rates of violence against women. So these interconnections are very prominent in the discourse, and the need for inclusionary perspectives for men and boys as a part of this process to get towards a place of planetary healing. And then when it comes to women and girls, it was clearly noted within the report as well that the majority of data that was reported for women and girls was in the context of what would be considered as conservative family roles, the cooking, the water gathering, all of these kinds of components, of course, which are incredibly important for many families around the world. But it reminded me of some of the issues that we have within Indigenous communities around the data reporting that occurs. There's an Indigenous scholar based out of Australia. She's Aboriginal Australian, and she came up with this 5 Ds of data. And the 5 Ds are basically reporting the data of difference, the data of disparity, the data of disadvantage, the data of dysfunction, and the data of deprivation. And then she also contextualizes data under the BATTER acronym, which is often data that is blaming, aggregate, decontextualized, deficit-based, and restricted. So when thinking about the data that's collected, how we frame roles or assumed roles in communities, whether or not it's from a traditional standpoint or otherwise, really comes from the framing of how we actually think that data. And I often remind folks that the way that we see the world affects the way that we ask research questions. The way that we see the world affects the way we see research questions, which affects the kinds of data that we collect, in which case it affects our analysis. Even if it's quantitative data, we often assume that we're unbiased. But if the original questions and the way that we formulate our data plans are inherently biased towards specific gender roles that are assumed, then that's the data we're going to get, because the system's set up to do what it's supposed to do. And if you set up the system to collect certain data, that's the data that you're going to get. And it's going to perpetuate some of those assumptions around gender roles within communities in the solutions that we attempt to think about. So I wanted to note that. The other thing that I think was, important to note, particularly from, again, coming from an Indigenous perspective, is some of our Indigenous languages don't have binary gender language in them. In fact, some of our Indigenous languages have 5 or 6 pronouns. Some don't have pronouns at all. And in fact, in some communities, the names of people are differentiated based on the amount of feminine characteristics versus masculine characteristics, regardless of sex at birth. And because of that, we have very special people in our communities. We call them Two-Spirit people, which are people that embody different gender aspects within their being. And we consider them actually very sacred and spiritual people within our communities. So being inclusive, of course, of different community values and notions around the world and how we actually see gender, I think, is incredibly important, because when it comes to planetary health, those are actually the people that we look to, because they're seen to have the blessing and gifts from both masculine and feminine, and can help bring answers towards some of the issues that come in regards to gender roles. There was a note in report, and I'm going to quote one of the sentences that were reported. And it's stated, we can also learn from ecofeminists' call to move beyond masculinist techno-scientific approaches and seeking a range of solutions to planetary health injustices. And, you know, it's no surprise to many who've been parents that if you do have boys, that they tend to gravitate towards certain things, trucks, gadgets, computers, those kinds of things. Not all boys, because again, we're respecting those gender diversities components, but generally, if you've had kids, you've noticed that there's tendencies towards there. In which case, if we have the majority of leaders, CEOs, as we saw, I think it was 84% CEOs of for-profit companies being males, that the kinds of solutions that you start to think about gravitate towards a certain way. Because our Indigenous communities, for the most part, not all, are matrilineal, the way that we think about the world in operations is very heart-centered. So the kinds of solutions are very much not towards the, as they put, masculinist techno-scientific approaches, but very much approaches for the heart. And many of our Indigenous communities have called for a greater appreciation and approach for the feminine within these leadership roles. And I'll wrap up with an experience that I had a couple months ago on a hiring board for a fairly high-level position within the federal government of Canada. And there was two final candidates, a self-identified man and a self-identified woman. And in the end of the vote, I found it so striking and interesting in 2024 that all of the folks that voted on that committee board for women were women. And all of the committee members that wanted the male were male, 100%, straight down the line. And I sat there, you know, wondering how in 2024 we're still in this position where we see the kinds of leaders, the kinds of leadership roles that we see to be successful in a fairly high position are still very much aligned to these gender assumptions. So I'll leave it at that in terms of initial remarks, because I know we're going to have some discussions based on some questions. Masicho, thank you.
Great. Thank you very much, Nicole. That was very informative and interesting. And yeah, and well, all your points were really thought-provoking, but I think you summarized some of the issues with the lack of sex disaggregated data really nicely for everybody. So I don't have to do that. So that's great. But yeah, I just wanted, before we move on to the Q&A, I wanted to just pick up on a couple of things that came out in our analysis of the findings that Manasi presented earlier. And of course, one of the things was the lack of sex disaggregated data. And another thing also links very clearly with what Nicole was talking about, which was around gendered roles and responsibilities. And one of the things that was very clear in the report, and you know, you can go away and read this in more detail, was that what we saw was that all of where gender was discussed, even where it was kind of presented in a gender transformative way, I think without exception, the majority of programs all promoted what we would call a feminization of responsibilities and obligations. And this is a term developed by the feminist geographer Sylvia Chant. But so she talks about this in the way that, you know, the kinds of things we see here, that women are sort of presented in the planetary health programming discourse, at any rate. Sorry, I need my glasses. As being responsible for kind of saving the planet, and that they need to draw on their caring and nurturing skills and the kinds of roles and responsibilities they have. So, for example, we see cases here, and the points that Manasi raised around sort of clean cookery programs, that, you know, there's no questioning in this programming that this is a job for men. It's always, you know, a job for women, and women are sort of presented where gender is present. It's always women being presented in these reproductive roles. And, you know, we know already from time use data that women do, you know, a lot more unpaid care work than men. And this is yet another thing, another responsibility that's been placed on women's shoulders to save the planet and address planetary health inequalities. So I think we have to think really critically about how we bring gender into these programs. And you know, Anne spoke before about mainstreaming gender, and of course these things are really important, but I think we also have to think very carefully and critically about what that means and ensure that we're not just placing more responsibilities, more burdens, more obligations on women to solve the planetary health problems. And of course, as you know, Nicole raised and others have raised, you know, where are the men in all this? And you know, who's placing responsibility on men's shoulders, and you know, educating boys in order to be sort of better citizens in the context of planetary health. So I think, you know, it's important that we bear that in mind. And while it's very positive that we see organizations engaging in gender, I think we also need to, you know, be cautious about how that's being done and what the longer term implications of that are. So I'm going to open the discussion to the floor in a moment, but can we just move back one more slide, please? Oh, no, sorry, another one. Yes. Yeah, and perhaps while we're taking the questions and questions and then answers from the panel here, you can review our takeaway messages from the report. So I won't go through them, but obviously please feel free to raise questions. So yeah, please, I'll collect a couple of questions and then we'll you can decide if you want anyone in, you know, if you want to direct your questions specifically to Anne and Nicole or to the whole panel, please make that clear. But I'll collect a couple of questions and then we'll move on to answering them. And if perhaps you could say your name and your institutional affiliation or where you're from, just so we have a bit of context, make it a bit more friendly.
Hi, I'm Ben. I'm from Belgium. I have a question because I heard in the report that there was no you did not find any organization reporting on actions that they took that were specifically directed towards like what I would call like gender diverse individuals, like queerness, I would call. And I was just wondering if there are action points that could be taken to also strengthen, or that you have like recommendations for organizations to also try to like work on that, to report on that, because I feel that's in the conversation around gender, it's often something that really lags behind.
Thanks. Sharon Friel from the Australian National University. Really fantastic discussion and huge congratulations to the brilliant Global Health 50/50. It's so good. It's sort of a question related to maybe just a little bit more information. So I'm intrigued. So particularly in the for-profit space, I know there was a relatively small number of organizations, but that they're claiming to do work in planetary health. So one, I'm just a bit intrigued as to what that actually means and whether that's just corporate social responsibility spin. And then if it is that type of corporation and there was no woman, is that correct? There was no woman in the on the boards. And is it that that type of organization and the interests of that organization are so sort of diametrically opposed to the sort of the values and the principles that we're speaking about in terms of gender diversity, real planetary health equity aspirations? So it's how a board makeup or a company practice that is just, or a company practice that is so diametrically opposed to the principles of gender equity, planetary health equity. I'm just intrigued, I suppose, of how the report, and maybe this is a question to you, Ken, like how you're seeing the report help to consider change happen within those sorts of organizations, if I understood those organizations correctly.
Ben, let me take yours first. Thanks for that, that question. And I guess I'd say a few things. One is that I think we just need to carry on working in terms of getting people to understand the difference between sex and gender. There is a lot of confusion there. And I think that what we see is that most governments, when they report census data or health data, they don't make a distinction. They don't tell us whether or not they're talking about sex or gender. And I think so that we all have a role to be demanding governments be clearer about when they're reporting on sex and gender. And then I think the third step then to say that gender isn't binary and that they need to collect data beyond the binary. And I think that was that Nicole was getting at that as well. And so I think that, you know, the world of global health is gender blind. We're seeing that the world of planetary health could do better. And I think that we all just, when we develop a roadmap for planetary health, we need to include those issues in that agenda. And I don't know if you have any or other people have any other ideas in the room about how to do that, but it seems to me that there needs to be a process of education, because the community has been far too accepting of gender blindness, that we're all just equal, and we're clearly not all equal. And so we need to get people to think about differences in an intersectional way. Gender is one of them. Sex is one of them. Income is one of them. Where people are from is one of them. Nicole asked who these women are that sit on the boards. Who do they actually represent? And it's a very good question. We're able to talk about their nationality, but because of the way data is presented, we can't say much more about them, unfortunately. Sharon, I'm going to pass over to Manasi to just let you know exactly what we did. I guess my own reflection as a political economist is that we've seen in our sample over 7 years, greater commitment to gender equality and greater commitment to diversity and inclusion. What we haven't seen as much is actual action on that and changes in outcome. And sadly, Ben, what we haven't seen at all is any increase in the reporting of sex disaggregated or gender disaggregated data. So that's why we just need to keep pushing. But the cynical side of me says that if we think about who has power in society, corporations have a lot of power. The public sector, sadly, has increasingly diminished power, and the not-for-profit sector even less power. And that what we see is an increase in women on boards of less powerful organizations and men still keeping the table where the actual power in society lays. So that's sort of my, you know, one approach to it. Your question was what we can do about it. Well, I think what we're trying to do at GH 5050 is, on the one hand, just draw attention to it, and that is clearly a first step. But I think that in the same way that the climate community has taken their message to the investor community and talked about what's acceptable and what's not acceptable in terms of investing in fossil fuels, you know, there's those kinds of tactics that could be employed. I'm going to pass the microphone down because this question of how do we bring about change is one that goes beyond, obviously, gender on the boards of corporations?
Yeah, it's an important question. Part of the challenge, of course, is with these organizations, they control over the kinds of data that they decide to collect. So without outside pressure, and this could be, you know, one of the things I often think about is these organizations get money from somewhere. So, you know, why not work further upstream and think about the funders? And can we actually work with funders to try to create mandatory reporting processes as a part of the funding requirements alienated? Because frankly, if you just leave it to organizations, they're going to do what organizations do, which is likely to report data that's easy to gather and easy to report. But thinking more upstream is always something that I like to think about. How do we tackle funders, get funders on board, or who these organizations are reporting to create better requirements? Because again, you need some incentivization, I think, to be able to get change to happen.
We're just going to go to Anne because I think she's well placed to respond, and then we'll come back to Manasi, who'll talk about the report.
Yes, thank you. Indeed, we're on the financier side, but quickly touch on Bernard's question on the gender diverse people in projects, and then talk about the other one. From our perspective, like from the projects we work on as development finance institutions, and as I see in the community, we all have initially gender equality strategies, systems, and so forth. But we are seeing more and more of the gender identity being opened up, and institutions are like developing, revising, and, you know, a part of the strategic development and opening up for gender to be more than just men and women. So you are seeing that evolution in the strategic and financing side of the ecosystem. But and at the same time, in projects, we do have projects that do include gender diverse people, whether we specifically say LGBTQ or others, or men and women, independent how they identify. But we also have to be very mindful of when we do have those projects, it's really about also the cultural context. And some countries, some regions have adopted that. So then you have the agencies or the companies that are comfortable in adopting this kind of also considerations. And in some other cultural context, it was also harder. So it's there's also so much we can do within the culture where we operate. So I just wanted to also say it is moving, but it's never going to be like a unified approach, and it's all sensitivities that this is taking, well, as we all know, a longer time to change. And as financiers, it's actually quite interesting. So I work directly with the for-profit companies, and well, actually my role is to have the companies well, first sensitize and understand why are we talking about gender equality, why diversity matters, and you know how we operate, right? We need the evidence to be convinced. And there's now the whole business case with the evidence, the data, why diversity on boards is more profitable. So you can share numbers now, right? There's those big firms that have come up with a percentage point of having more diverse companies, like mitigate better the risks, make it better informed decisions, and you know, you nurture innovation differently. And being able to present that to companies is starting to shift the mindset of, okay, I'm not doing just because it's a corporate social responsibility things, but it actually makes sense for the business. So this is how we try, or how we work with the companies to have them that buy-in and try and align with the social values. I think that you were mentioning that can be opposed. And in the reporting, we have the climate action results, development results as part of the reporting, the gender reporting as well. So this is something, and as an institution, we also have the dual climate and gender, well, 75% of our operations have to have those indicators and, you know, measure that over the time of the projects. So it's definitely something that you see has taken up for quite some time on gender, now more also on climate, and that's combined in all the project, and then it aggregates into what we call development effectiveness among the financiers. So it is an agenda that is definitely on top of all the development financiers, and that you also have working groups and alignments of how us as financiers, we do an approach, and how we also try and push when we investing. We're stronger to tell a company, look, this is how it is, right? With development finance, this is the consideration you have to take into account. So I have seen the uptake, and especially from private sector, because it's kind of a new push to being systematic, and it's definitely being more having people more aware and understand, and then once they have that, they can do something about it. So I'm a bit more hopeful that maybe the question was asked, because I work in that area, and I can see the improvement. I think it's more the overtime and the constant sustainability, or being constant about those initiatives, that takes more time than just, you know, changing one thing or the other, and you want to see the results tomorrow. Yes, let me stop here.
Yeah, just to answer your question about our inclusion and exclusion criteria, about especially for the for-profit sector, we did exclude any we excluded any organization that did not have any formal planetary health objectives, programs, or even if they did have internal sustainability practices or goals, or what you mentioned as CSR or ESG. So, you know, just limiting their global greenhouse gas emissions and things like that wasn't enough to include them. We also included some pharmaceutical companies that were specifically working on building resilience and sustainability of their distribution chains and supply chains, and their products. So yeah, that answers the question.
Yeah, and just to add, we did have an interesting conversation about, you know, including these pharmaceutical companies, but that's perhaps for the coffee break. Okay, so we've got time for another round of questions. So please, yeah.
Hi, my name's Genia. I'm a student at Harvard. And something I was curious about is this concept of masculinist values, as Dr. Redvers mentioned, especially if like it, per like Iris Young's work, if you're familiar with like feminist literature, she cites that, you know, corporations are kind of inherently masculinist because men are kind of competitive, or not, I'm not saying men are, but in her work, that is like a characteristic there. And so I'm wondering if the right way to quantify these types of things is by looking at board membership for an inherently competitive role on these like boards and leadership structures, and if you all maybe thought of different types of metrics that you could utilize that were inherently more gynocentric or non-masculinist in that way. Well, I don't have any ideas other than maybe looking outside of like board and governance structures. So maybe thinking through either policies or maybe even affinity groups that are led by women in corporations. But of course, that takes a certain size of organization. But I'm wondering if you all had any ideas.
Okay, we've got another question here, and then we'll leave it to Kent to answer that one.
Thank you. Dowd Vickery. I'm retired, but I'm active in an organization called the Responsible Finance and Investment Foundation. I'm an ex-banker, but I'm a humanitarian who probably saw the light. More observation than question, and this has been a fascinating session. The observation I have is on Nicole's comments about follow the money, or look where the funding is. And if I can draw a parallel, my experience is not in your area. I'm deeply concerned about gender balance and so on, and have been for 20 years, because I signed something called the Pledge, which you may be familiar with 20 years ago, where I won't speak on a panel unless there's gender representation or equal gender representation. I'll give you an example. Pre-COVID, working in the finance area, we were looking to see what we could do to influence the financial institutions in Malaysia to adopt more sustainable agendas. And if you follow the money, you look at the situation in Malaysia, 60% of the Malaysian financial institutions are owned by 4 institutional investors. You get the institutional investors together and you change their mindset about sustainability. As a result, we've seen great strides taken in financial institutions in Malaysia who are, for a developing country, leading in many areas on sustainability. We're also seeing in financial institutions gender balance, although I'm not sure it's the right metric, on boards. Over 40% female representation on the boards of financial institutions. So that's the observation. But I think the challenge is, and sometimes it's awkward being a male raising the question on this, but it is actually changing the perceptions. And I think the perceptions can only be changed by the education. I was particularly taken by your presentation this morning, Nicole, and your comments today about sort of going back to the basics of the indigenous people. And the indigenous peoples have this opportunity where they're considerably always thinking about 7 generations forward, making the decisions for 7 generations. And it's a holistic decision. So I think there has to be something about going back to basics, changing the perceptions and improving the education, or at least the awareness, so that we don't go down this silo of male-based gendered decisions. Observation's probably not a question in it, but I wanted to share the experience that it can be done and attitudes can be changed. But from my experience, following the money is the way to do it. And you need to use some intelligence in figuring out who is actually funding what and target them specifically to change, because they have huge, huge influence. Thank you.
So just 2 things quickly before I hand over. And one of the things I did try to stress was the limitations of what GH 5050 can look at. And it's a very small organization, and it's been done in our spare time over many years. And what we decided to do was to look at what these organizations put in the public domain. We just report what they put in the public domain. And when they don't put something in the public domain, we try to name and shame them by saying this information ought to be in the public domain. But we did hire an organization called Gender at Work to see if they could come up with any additional indicators that we could use. Gila, I'm looking at you. And they came up with 2 that were essentially associated with affinity group type things in organizations. And we measured that for the first time last year, and we'll be reporting on it. But we really are challenged to, as an organization that will only look at what's reported externally. And what we try to do is global, even though most of these so-called global organizations are based in the global north and their leadership is global north. They still purport to be global north, but they're headquartered in different countries, to be sure. Those different countries have different jurisdictions, and they have different sort of definitions of what protected characteristics are. And so in the United States, it's okay to ask employees what their race is. But what I'm trying to say is we're quite constrained in terms of the data that we can collect that's comparable across the globe. But we are trying to dig a bit deeper below the surface to answer your question. And then, Sharon, I'm going to put you on notice in case if you want to engage in the conversation around follow the money. One of the things that we've done at GH 5050 was we identified a set of donors that had sort of feminist leanings, let's say, or formally feminist foreign policy like SIDA. And we made sure that the Swedish SIDA knew who the low performers were consistently in our sample. And they then wrote directly to the management of those organizations that they supported and said that they wanted a management response. So at sort of a much lower level than you're talking about, the investor community, which I agree to you would be a useful one to go to try to mainstream these notions of using the language and the metrics that they use. But I was putting Sharon on notice just to ask her if she had any thoughts on that. Professor Sharon Friel is one of the world leading experts on commercial determinants of health. And I don't know if you want to say anything to the following the money or okay, because I think we're going next to masculinity and or do you want to say something before we go on to that? Yeah? Okay, excellent.
Thank you. I had a question for you really in terms of the getting into those rooms, like being able to have the conversation around the table with those who are at those tables. Because certainly in the work that we've done in the commercial terms of health that Kent's referring to, really the big investors behind the corporations is where all of the power and the opportunity, I think, absolutely lies. But I was very interested in your sort of reflections on having the authority, the legitimacy, the mandate to get into those rooms. Certainly my endeavours to do that with some of the big institutional investors is, you know, I'm seen as the kind of the bleeding heart, talking about planetary health and blah. But so I suppose you bring the credibility, or it's how do we make use of collectives, of networks, of connections, where being able to bring in these sorts of concerns, these sorts of values into a space, but you've got to have the credibility to be able to do that. I think that's certainly what the literature would tell us as well. So I was just intrigued as to how can we talk more with you?
I agree. We went in as a responsible finance and investment foundation. I'm a founding trustee, and I've run two banks here in Malaysia, so I have some credibility. But one of the founding trustees was the former governor of the central bank here, Tan Sri Dr. Zeti Akhtar Aziz, a lady who was the first female governor of the central bank. We've had another one since her retirement. And I absolutely agree with you. You have that credibility and you've got to do some research. But to get into the room, you've got to have some level of professional credibility. You can't just sort of walk in and say, I've got a good story to tell, unless you're very, very lucky. So it's engineering that position, doing some kind of research and publishing it. So on the background of the research that you're doing, it's using that to get into the boardroom or into the institutional investors and then talking about it. What we found through going through that process was that there was a huge amount of sympathy and empathy with what you were doing. And in actual fact, although they hadn't been very public about it, most of the institutions had already decided to go down that course because they didn't see a viable alternative. They saw it was the right thing to do. But you're absolutely right. You've got to have some street cred in order to get there. Thank you.
Okay, thank you. I think, Anne, I don't know if you'd like to come in and comment on anything. Sorry, putting you on the spot there.
No worries, of course. It's interesting on the follow the money. We having the dollar amount for us is, I think, the critical way as well. How do you actually, you follow the money and how do you capture that in how it translates? And because we're dealing with gender or climate or planetary, you know, it's big sectors. So how do you make sure that with this money and how do you account that for each of the intended aspects that you want to see. And that's also the difficulty, right? When you, as an investor financiers, it's usually larger projects and you make it accountable to what this money actually contributes to as the more granular. We love to say, you know, the gender financing amount, and you might have heard of the there's a 2x challenge that certain development finance institutions in CEDA, the counterpart of CEDA from the private sector, is also part of, for example. But we all trying to say, because that's what matters at the end, right? That transparency of where the money, how the money is used to actually make the difference on the ground. Otherwise, it remains the theories and the good to have. So I do tend to agree that it's one of those discussions that is also critical yet very difficult as we're dealing with it's different sensitivity, I think, and then we're not all at the same space or readiness status to do that. So then it becomes very scarce, and then the numbers will not really relay the reality, just because sometimes it's just methodology or capacity behind. So it is maybe more complex than simple answers just, you know, do that. It requires so many different systems approach behind that I think different stakeholders, you know, are maybe getting there all together, but not always know how, and there's no unified approach to that. So it is a aspiring yet complicated, but definitely much needed way to think or perspective to have when we talk about those cross-cutting results.
Okay, thanks, Anne. So Nicole?
Yeah, I think we're getting close to time, so maybe some final kind of consent. I wanted to make a comment what you were talking about with the different metrics perspective, because, you know, in a best case scenario, of course, we have access to a lot of data that contextualizes a little bit of the situation, because even when you think about board level approaches, even if there's parity, it doesn't talk about the power dynamics within the board and who's actually, you know, really riding the conversation. There was an interesting report some of you may have seen in the last couple of weeks that was demonstrating within academic institutions that despite women having similar positions and roles within the university, that women were carrying the majority of the service load. And in fact, men were actually actively deflecting service roles within that. You know, and it brings to mind that despite the equivalency of the positionality of the schools, that there's still an inherent power dynamic in terms of who's taking on these roles and the kinds of roles that they're actually fulfilling. So, you know, there's a lot of nuance there that I think is not appreciated within some of the generalized metrics that are hard to pick out. You know, there's no easy answer to that, but it's an interesting thought to think about, you know, as this work moves forward, is how do you be able to capture some of that more nuanced approach within the decision-making, you know, communities that exist within these organizational levels. And then, you know, maybe finally, as we think about moving forward in this topic, because, you know, planetary health, of course, is the topic at large. And one of the things that we've seen very clearly, at least what I've seen within the communities, is that we do tend to see a lot more women, particularly young women, taking roles and responsibilities within the Planetary Health Committee. That's not exclusively, but I've been in this space for quite a while now. And I would love to see our men and boys stand up as leaders too within this role, and really empowering, not empowering, that's a bad word, but giving respect and honoring for our men and boys who I think within a modern society, particularly within the traditional roles, are often, you know, created expectations that really minimize their abilities to work within this space in a good way. So I just want to say that, because I think we get a lot of focus on the women and girls, which of course is incredibly important, but I also want to remember our men.
Yeah, and just again to perhaps a final comment to follow on from what Nicole was saying, and to go back to the point about the metrics and these sort of, you know, socially ascribed roles. I mean, again, I think one of the things that we need to think about, especially those of us that are involved in education, is, you know, what we're teaching. And we're not going to be able to move away from these kind of masculinist models of knowledge and science if we don't challenge the curriculum and challenge what's taught. And, who gets represented on course curriculums, be that at school level or university level, and just thinking much more critically. And, you know, and again, kind of using the educational spaces that we might be involved in to challenge, you know, who gets to speak and how they get to speak and what gets recognized as knowledge. And again, I think this is one of the things we do advocate for in the report, but I think it's also something, you know, to think about moving forward and how we go about addressing some of these future challenges. So perhaps I'll finish there, and I think we're running out of time. So I'd just like to thank Anne, and I'm very sorry you're not in the room with us, but, you know, in person, but thank you for joining anyway. And Nicole and all of you, and hopefully we can continue the conversation over coffee. And please take a leaflet that's that's got the QR code for the report on there, and the contact details for GH 5050 there as well, if you'd like to get in touch with any comments or feedback later. And thank you all very much for joining us this afternoon, and have a productive conference. Thank you.
Thank you, everyone. Bye bye for now.
Sorry,
We'll
just
the rest.
sorry, Anne. Oh, she's gone. Yeah, and also to thank Sunway for not only their invitation to the conference, but for their participation and support in producing and writing the report. So thank you. I think Nazia's not in the room anymore, but Nazia and her colleagues were fantastic support in all of that. So thank you.